It's important to know that there's a spectrum of physical therapy. Some good, some bad. In my opinion, mostly bad. And in this video, I'm going to let you in on a little secret. So what makes physical therapy good or bad? Well, most of the time, the body's going to heal itself. Strains heal in 6 weeks, sprains in 12 weeks, bones in 8 weeks. So if it's taking longer while you're in therapy, that's not a good sign. Therapy should help optimize the healing process. And with more chronic issues like low back pain or arthritis, physical therapy should help sooner rather than later. In fact, unless there's a cognitive impairment or you're at risk of falling, you should not be in therapy for much longer than 8 weeks. If your therapy is taking longer, either the therapy is not working or they're looking to make money. But once again, cognition and fall risk are the exceptions. Otherwise, you can learn the techniques and safely perform the exercises at home. In fact, most of the techniques supported by quality research are simple exercises that most people could perform at home. Many of the hands-on techniques do not have as much research support. Of course, it feels good to have your joints mobilized or massaged. This is not going to fix the problem in the long run, and research shows this time and again. True musculoskeletal issues are resolved by changing movement patterns, performing specific exercises, and allowing your body to heal. All things you can do at home. Now, should you even be in therapy in the first place? Well, there are some very steadfast rules indicating that you should not be in therapy, and here's a list. The most common issues are extremely high blood pressure or heart rate, or swelling in both ankles. These are warning signs of more serious issues that make a person unfit for therapy. A good therapist will take your blood pressure and check for swelling in your ankles before you even get started. If you're in therapy with any of these issues, you may be doing your body more harm than good. For more on this, see my video on red flags. Now, a lot of people wonder if therapy could actually make the situation worse. And the answer is a resounding yes. Here are a few common examples. Say a therapist is treating shoulder pain and weakness, but they're unable to realize that it's actually referred pain from an issue at the neck. This could delay serious surgery and greatly diminish good outcomes. Furthermore, if they're trying to strengthen the shoulder with repetitive overhead motion, they're wearing down the rotator cuff and putting you at risk of injury. I've seen therapists cause rotator cuff strains and even worse, tears, and the patients are often completely unaware. All of this could have been avoided by finding a good therapist. So let's say you're actually a good candidate for therapy. What constitutes legitimate treatment? Well, there needs to be an order of priority. Otherwise, you're just doing random exercises, and that's going to make things much worse, and that's typically what happens. So here's what needs to happen. First and foremost, if there is any swelling or any edema, it needs to be addressed with edema management techniques. This is because swelling shuts the muscle off by 40% or greater. So you're not going to be able to strengthen if you have swelling. And this is going to cause increased stress on the joint, micro trauma, and more pain. Swelling needs to be the first thing that you address. If you need more help on this, watch my video on swelling. Next, you need to learn some healthy movement patterns, i.e., you need to learn how to stop hurting yourself. People with chronic injuries continue to push into pain, and this causes micro trauma and re-injury, which prolongs the healing process. As I like to say, it's no longer no pain, no gain. It's less pain, more gain. So you need to stop pushing into pain. If you need more help on this, watch my video on pain and my video on movement mechanics. Once these issues have been addressed to at least some degree, you could begin strengthening. But more often than not, strengthening is performed the wrong way, and that's because to strengthen intelligently in a way that actually benefits the body, it takes a lot of research knowledge. Here are some key factors. First, you need to be performing the proper rep schemes and frequencies. Next, you need to target the muscles that actually benefit the joints. While some muscles are beneficial to strengthen, strengthening other muscles can actually cause problems at the joint. Next, you need to use movement patterns that create optimal joint space to avoid wear and tear on the joint. And lastly, you need to go slow, not low, use less weight, but concentrate. This allows you to strengthen the muscle metabolically instead of stressing the health of your joint. Now, I have an entire video on the most intelligent way to strengthen, so watch that if you need more guidance. But by far the biggest mistake I see are therapists and patients performing the same exercise every day back to back. And it should be known that in order to strengthen, a muscle needs a full day's rest to recover. Otherwise, you're overtraining and you're not gaining. So if you strengthen your quadriceps muscles on Monday, you should not be working your quads on Tuesday, but you could do it again on Wednesday. Now, once a person has progressed with their therapy, they could begin to address balance. Keep in mind, after the age of 65, falls are the leading cause of traumatic death, so it's very important to address balance. The key with balance is to work on a stable surface. The foam pads that you see people standing on dramatically decrease strength gains and open you up for knee injury, and that's based on good research. So you should work on a stable surface. You should also work balance about 18 minutes a day, challenging balance while walking with a trained spotter who will not let you fall. By and large, the biggest mistake I see when addressing balance are therapists and doctors telling patients they're no longer a fall risk without performing any kind of fall risk assessment. These judgments are typically based off of personal feelings and ego, which is a dangerous thing because time and again I've seen this lead to falls resulting in hip fractures and broken vertebrae. A quick and easy fall risk assessment is a 5-time sit to stand. A person should be able to sit in a chair with their arms crossed without pushing off, arms crossed, stand and sit 5 times in under 15 seconds. If they're unable to do so, they are at risk of recurrent falls. These people who cannot pass these tests may not believe that they're a fall risk, but this research is tried and true, and a fall risk is the reality. Now, everything I've discussed describes legitimate therapy. Now, it's true while in the nursing home setting, therapy often involves just getting out of bed and walking. But all the above techniques should be applied or you're not going to have real results. And you don't really want to be in therapy just to be playing patty cake. Now, if what I've described does not sound like the type of therapy that you're receiving, or if you've been in therapy for a long time, or you're receiving primarily hands-on techniques without exercises, or your therapist is using a lot of e-stim or TENS treatments, I would question those techniques and I would ask your therapist to supply the research behind what they're doing. Last, but definitely not least, you do not want a lazy therapist. If your therapist is primarily sitting in a chair throughout your treatment, they are not a therapist. They are a chairapist, and chairapists are not doing their job. So I would advise you to move on to another therapist in that case. Well, there you go, and now you have it. Is your therapy a waste of time and money? You be the judge. Visit ptrehabdoc.com to find therapeutic workouts for the shoulder, neck, low back, hips, knees, and full body. And remember, if you're going to work out, do it in a way that helps you gain strength without sacrificing the health of your joints.